Please. Well, good afternoon, everybody. I first of all want to thank all the members of the cabinet and our senior staff for joining us here today for this emergency meeting. And I want to thank the entire team, particularly our health department, but every single agency who has stepped up during this state of emergency to help us deal with this crisis. And I want to begin the meeting here today by providing the latest up-to-the-minute updates on our state's ongoing response to the coronavirus. Nationwide, there are now more than 750 cases of COVID-19, and there have been 26 deaths. The state of Maryland now has 8 confirmed cases of COVID-19. As I announced yesterday, 6 additional Marylanders recently traveled on the same Egyptian cruise ship, but on different dates, as 2 of the state's first positive cases. Our state health department immediately contacted all 6 of the individuals, and out of abundance of caution, all 6 were self-quarantined, and we're testing all 6 of them. Earlier today, we confirmed that 2 of these additional individuals, a Prince George's County couple in their 50s, also tested positive for COVID-19. They are at home and they're in good condition. Our team at the Maryland Department of Health believes that there are no major concerns regarding potential exposure risk to the community. Neither of these individuals appears to have attended any gatherings or events. The New Jersey and Maryland Departments of Health are continuing to work closely with the organizers of the recent Conservative Political Action Conference at National Harbor to provide guidance to all of the attendees and employees who worked at the event. As you all know, this problem continues to evolve and escalate rapidly. Information is changing not only on a daily, but on an hourly and almost minute-by-minute basis. I am fully committed to being as transparent as possible by providing the facts and keeping Marylanders informed and taking actions based on detailed planning and making decisions based on the facts on the ground. I want to take just a moment to go through all of the actions that our team has taken at the state level on this crisis. More than a month ago, at my direction, our administration initiated actions for the preparation and mobilization of all necessary resources in order to address the coronavirus. State health officials immediately began working with the CDC, NIH, and other federal agencies and officials, and with local health departments and hospitals to activate an aggressive and collaborative response. On February 27th, we held a press conference from the State Emergency Operations Center of the Maryland Emergency Management Agency to announce that the Maryland Department of Health had activated public health surveillance and clinical guidance protocols in every single jurisdiction in the state. We began holding daily briefings between state health officials, the CDC, and federal authorities, and working with local hospitals to develop comprehensive hospital surge plans. Last Monday, as chairman of the National Governors Association, I joined Vice President Pence in the White House Situation Room for a teleconference with top-ranking federal officials and nearly all of my fellow governors regarding a coordinated federal-state response to COVID-19. Tuesday, we received approval for the Maryland State Public Health Laboratory to be able to do our own testing for the coronavirus. On Wednesday, at my direction, the Maryland Emergency Management Agency raised its activation level in order to mobilize additional resources, and we submitted emergency legislation to allow the transfer of up to $50 million from the Rainy Day Fund for costs associated with the state's coronavirus response. On Thursday, our administration submitted a supplemental budget which included $10 million for emergency coronavirus preparedness funding. Later that day, we confirmed the first 3 cases of COVID-19 in Maryland, and I immediately issued a proclamation declaring a state of emergency in order to further mobilize all available state resources. On Sunday, we announced our 4th and 5th coronavirus cases. Yesterday, I attended another meeting in the White House Situation Room with the Vice President for a teleconference with 48 of America's governors. Right after that, I returned here to Annapolis, and with House Speaker Adrian Jones and Senate President Bill Ferguson and we signed the emergency funding legislation into law. Yesterday, we also established a Maryland coronavirus response team made up of the top doctors and scientists in Maryland, which will be meeting later today after this cabinet meeting. And we sent out guidance for state employees. Last night, we confirmed a 6th coronavirus case, this time in Prince George's County. And today, we confirmed an additional 2 cases in Prince George's County. As of now, we have 4 confirmed positive cases in Montgomery County, 3 positive cases in Prince George's County, and 1 positive case in Harford County. A few moments ago, I met with leaders of the state's long-term care community, which includes nursing homes, assisted living facilities, and retirement communities. Federal health officials continue to stress that as we begin to expand testing, we should expect that the number of cases will continue to dramatically and rapidly rise. And the nation and the state of Maryland will be shifting from containment to mitigation. Older people and those with underlying health conditions are much more vulnerable and at significantly higher risk of contracting the disease, with morbidity and mortality rates that are 3 to 5 times higher than the flu. So far, we have had 42 deaths in Maryland from the seasonal flu. That is why, in coordination with the federal government, we are advising older people to avoid crowds and large gatherings, and to avoid traveling, flying on planes, as much as possible. Nursing homes and retirement communities are the areas of greatest concern. The nursing home in Kirkland, Washington, continues to be the site of the worst COVID-19 outbreak in the United States. 19 residents have died, and 31 individuals still in the facility have tested positive for the virus. We want to do everything possible in our power to prevent a similar outbreak in our state. Today, the Maryland Department of Health is issuing the following recommendations to our state nursing home facilities. Effective immediately, nursing homes should restrict access to visitors. Facilities should make online methods of face-to-face communication and phone calls available to nursing home residents. All facility staff should be restricted from international travel and should be monitored if they have traveled out of the country within the last 14 days or have had contact with someone who is under investigation for COVID-19 or are showing any signs or symptoms of a respiratory infection such as a fever, cough, or sore throat. And healthcare providers who have signs and symptoms of a respiratory infection should not report to work. Any staff that develop any signs or symptoms on the job should immediately stop work, put on a face mask, and self-isolate at home. They should inform the facility's infection preventionist and contact their local health department for next steps. We are asking nursing homes in our state to increase the availability of alcohol-based hand sanitizer, tissues, no-touch receptacles for disposal, and face masks. at healthcare facility entrances, waiting rooms, and resident check-ins. They should increase signage for vigilant infection prevention, properly clean, disinfect, and limit sharing of medical equipment between residents and areas of the facility. With the action we are taking and announcing today, and while I want to make it clear that older Marylanders are the most vulnerable to the virus, I understand that there are also going to be a lot of questions about other proactive measures that should be taken with respect to schools and education facilities around the state. Earlier today, I spoke with Chancellor Jay Perman of the University System of Maryland, who just announced or is about to announce their guidance for all state universities and colleges. He has asked the university community to prepare students to remain off campus for at least 2 weeks following the end of spring break. Universities should be prepared to continue all courses online, but all campuses will remain open before, during, and after spring break. I want to continue to remind everyone that this truly is an all-hands-on-deck operation, and it is going to get worse before it gets better. I want to continue to encourage Marylanders to stay informed by visiting coronavirus.gov. Maryland residents can also get the latest updates at health.maryland.gov/coronavirus. Or if you have any concerns or questions, residents can also dial 211 to connect with a helpline representative or to get information and community resources for the coronavirus. Now, at this time, we're going to continue with our normal cabinet meeting, which is going to start after some opening remarks with the Lieutenant Governor and Chief of Staff. We're going to start with Deputy Secretary of Health, Fran Phillips. I just want to, before we let the media go from the room, I just want to thank every single member of the team for all of your dedication. We're all in this together, and it's going to take every one of us giving it everything we've got. So thank you very much. And with that, we'll take a short break. Thank you all very much.